A pregnant woman in active, painful labor is refused care due to paperwork, and technology could have prevented this tragedy. Welcome back to Digital Transformer Guy, where we break down real technology failures, real human consequences, and the architecture that could prevent the next public disaster. Today, we're analyzing the viral Mesquite, Texas hospital incident. A young pregnant woman in obvious active labor delayed at the intake desk over paperwork, despite the fact her mom called ahead of time to let them know she's bringing her daughter in for the emergency. Millions saw the video around the world, but what millions did not see was the system failure behind it. Here's the central question. Could AI-enabled triage have prevented that delay? The answer? Yes, absolutely. And today, I'm going to show you how, with real architecture diagrams, real workflow logic, and a real enabler epic you can implement. From a system perspective, the failure wasn't just human, it was architectural, technological, even process design flaw. No pre-arrival data sharing, no digital intake, no visibility into contraction timing, no ETA tracking, no automatic labor and delivery escalation, no bias mitigation logic, no integrated triage intelligence. What we saw on camera was the symptom. The root cause was a lack of intelligent, connected infrastructure. So what the system should have done. Imagine the mother of the pregnant woman uses a labor tracking app, timing contractions, logging intensity, confirming water breakage, noting mobility issues. Under a modern digital triage model, the app would, number one, send contraction telemetry. Number two, send medical history and pregnancy risk profile. Number three, send car GPS ETA. Number four, report car movement patterns. Number five, sign all intake forms digitally. When contractions accelerate past a risk threshold, the system automatically flags active labor transition phase and then generates a risk score, assigns a triage priority, sends a recommended action to L&D, labor and delivery, and sends a nurse alert. At that point, the hospital knows this patient is arriving in active labor at the north entrance in 90 seconds. As I've done in previous videos, I like to dive into the agile epics, including features, user stories, and tasks. In this case, our main epic is AI-enabled maternal arrival and digital triage modernization. I want to focus on one feature called AI Labor Stage Classification Engine, which is a critical part of our proposed architecture. This feature determines whether a patient is in early labor, active labor, transition, or immediate delivery using telemetry, history, movement, self-reported symptoms. A key user story here is, as a supervising L&D nurse, I need real-time alerts when a patient crosses active labor thresholds so I can bypass administrative steps and prepare immediate clinical care. Very important. And that story brings us to the important development task. Build a real-time contraction telemetry pipeline using event-based ingestion, such as Azure Event Hubs or AWS Kinesis, refreshing every 5 seconds, writing output to a FHIR observation resource, FHIR, and pushing classification updates to the Nurse Alert dashboard via WebSockets. Now let's look at the architecture from the patient app all the way to the back-end hospital systems. Layer 1, Patient Smartphone App. Components of this layer include contraction timer, allows the patient or caregiver to record contraction frequency and duration so the system can detect active or imminent labor patterns. AI-assisted symptom prompts uses guided questions to help the patient describe symptoms accurately, pain level, bleeding, water breakage, even when under stress. Digital intake and consent enables patients to complete hospital paperwork, insurance details, and consent forms before arrival to prevent administrative delays, like we saw. GPS and motion tracking tracks the vehicle's real-time location and movement to estimate arrival time and direct staff to the correct hospital entrance. Identity verification verifies patient identity using photos or documents to create or retrieve the correct medical record before arrival. Now, on to layer 2, cloud triage intelligence. Components of this layer include AI risk scoring, calculates a clinical urgency score using contraction data, symptoms, and history to determine how quickly the patient must be admitted. Labor stage classification automatically identifies whether the patient is in early, active, or transition labor based on real time patterns. ETA prediction uses GPS and traffic data to estimate when the patient will arrive so hospital staff can prepare ahead of time. Bias mitigation scoring applies objective algorithms to reduce the risk that a patient's pain or urgency is dismissed due to human bias. Predictive escalation automatically elevates the patient's case to L&D staff when conditions indicate a potential emergency. On to layer 3, FHIR HL7 integration. FHIR, once again, is FHIR. Components of this layer include FHIR patient or FHIR patient. Creates or updates the patient's digital identity inside the hospital system before arrival. FHIR encounter generates a hospital visit record so triage begins digitally before the person physically enters the building. FHIR observation transfers clinical data such as contractions, pain, vitals, directly into the electronic medical record. FHIR location tracks where the patient is located, en route, hospital entrance, or room, inside the system for coordination and staff routing. And then smart on FHIR authentication provides secure access control so the app communicates safely with the hospital systems using industry security standards. And then finally, layer 4, hospital operational systems. EMR, EHR, Epic, Cerner, Meditech. The hospital's primary system where medical records, clinical notes, and orders are stored. L&D dashboard, once again, labor and delivery dashboard. A visual control panel for nurses and doctors showing incoming patients, labor status, and urgency levels in real time. Nurse alert engine sends automatic notifications to clinical staff when a patient requires immediate attention. Wheelchair dispatch logic triggers staff response to meet patients at the door when mobility issues or advanced labor is detected. Digital audit trail creates a timestamped record of every action to support compliance, risk management, and quality improvement. This is not futuristic. This is standard cloud, AI, and healthcare interoperability, just not applied to maternal triage. To give birth to all this proposed technology, pun intended, we need a roadmap of phases to make sure our workload is organized and easy to track. Phase 1 of 5, digital intake and FHIR connection. Build patient pre-registration and EMR connectivity. And then on to phase 2, contraction telemetry and AI layer. Add risk scoring and labor stage classification. Then phase 3, ETA and patient arrival tracking. Integrate GPS and car movement prediction. Phase 4, dashboard and operational adoption. Deploy nurse-facing and supervisor-facing dashboards. And then phase 5, finally, equity reporting and optimization. Analyze time to admission by race, shift, and staffing levels. If you're a chief digital officer, enterprise architect, or hospital CIO, this is your blueprint. And if you want the full enabler epic, system diagrams, or downloadable PRD, visit the latest post on Digital Transformer Guide at samsonasoftware.com. And remember, my new ebook, Digital Treasure Trove for Enterprise Solution Architects, includes a full chapter on designing AI-enabled life-critical systems. See you in the next video.